you. I am an ordained minister of the United Church of Christ, a professor at Austin Presbyterian Seminary, and a member of the board of directors of Texas Impact, the oldest and largest interfaith legislative network in Texas. Texas Impact has joined over 60 other national, state, and local religious organizations in a Friend of the Court brief submitted to the Supreme Court in support of the Medicaid expansion in the Affordable Care Act. It is this issue that I want to address. The brief with all the names of the amici is available on our website, and I have left a copy with the clerk here. The scriptures and teachings of Christians, Jews, Muslims, Buddhists, and other traditions tell us that a priority of the faith and the faithful is to attend to the needs of the poor and the sick. Over 700 verses of the Gospels describe the healing work of Jesus. This mandate applies not only to the people, to all of us, but also to the government that, according to the Scriptures, must execute justice and righteousness in the land. Mindful of that responsibility, faith communities have worked for decades to move our nation toward a more inclusive, just, and practical system of health care, with particular focus on the poor and the vulnerable. Congress expanded Medicaid through the ACA in response to the needs of 50 million uninsured Americans, many of whom are too poor to afford health insurance. Of course, of these, more than 12%, 6.3 million, are our neighbors here in Texas. Texas Impact and the faith communities we represent strongly believe that Medicaid expansion is the right and moral thing to do in Texas. Failing to implement the expansion of Medicaid not only denies health care access to millions of low-income Texans, it also jeopardizes the health care infrastructure that serves all the people in our state. It is difficult to reconcile such a loss with our religious mandates. Sorting out the ACA implementation requirements will not be easy, and I certainly don't envy your task in this. The faith communities we represent believe, however, that justice and righteousness must indeed be executed in the land. The Medicaid expansion does just that. Texas Impact and its members will work with you and support you in this challenging project, and we hope you will call upon us and consider us partners in your work. Thank you for your attention.
That's pretty good. 2.5 minutes.
2.5 minutes, outstanding, with a kind of a rough beginning with everybody getting seated. So thank you, Pastor. Any questions? Thank you so much for taking time. We enjoy working with Texas Impact.